Thank you, Chairman Dr. Wenstrup, my friend. We've had a very good bipartisan working relationship throughout the years, getting some good legislation signed into law together, and I'm looking forward to working with you in a bipartisan manner for the sake of our nation. The 117th Congress was a stellar Congress with a select subcommittee on COVID that reviewed nearly 1 million documents, had 394 letters sent, 42 hearings and briefings, 37 staff reports that have been published, and two overarching themes that we can grow from was, one, that we inadequately had the public health infrastructure to address a pandemic as large as this one, and we need to comprehensively take that lesson and invest in a public health infrastructure in order to identify these novel viruses, contain them, prevent them from being pandemics, and being able to mitigate and save as many lives as we possibly can while mitigating harm. The second biggest takeaway from that 118th Congress was the extreme dangers of disinformation and misinformation for political gain and not based on evidence or science, and that can lead to non-compliance or failure of therapeutics or misinformation where people are making decisions that put themselves and their families in harm's way. So when we speak of lessons learned and what went wrong, we must also have an honest discussion of what went right. And in fact, there were several things that went right. One is the investment to prevent more deaths and economic turmoil. We know that the economic support that was given worked in order to keep the economy afloat. However, the Democrats held multiple hearings last Congress focusing on the fraud and abuse that happened, and we definitely need to get to the bottom of it in order for that, in order to prevent that from happening again. Just recently, the Commonwealth Fund had a report on December 13, 2022, that showed that because of the administration's efforts, there were over 3 million lives saved. And that is a success. There could have been more, in my opinion. We should have had more. And so we need to understand the lessons learned, all the barriers of misinformation, disinformation, the politicization of this, and avoid those for the sake of our nation in order to save more lives. So today, the Select Subcommittee on Coronavirus Pandemic officially convenes for its first meeting of the 118th Congress. Our work comes at a crucial moment for our nation's public health. For 3 years, COVID-19 has presented our government and our society with unprecedented challenges. More than 1 million lives in the United States have been lost due to the COVID-19 pandemic. The COVID-19 pandemic was real and not a hoax, which laid bare vulnerabilities and inequities in our public health infrastructure and our economy. Although we have made significant strides to overcome the COVID-19 pandemic, we are still dealing with the long-term implications of this public health crisis. COVID-19 continues to pose a serious threat to the health of some of the most vulnerable in our communities, and the spread of misinformation or disinformation has undermined the American people's trust in our nation's public health institutions and in each other, further dividing us at a time when we should come together to grieve and heal from a crisis that has taken a toll on each of us, regardless of our political affiliation. As ranking member of the Select Subcommittee, I am optimistic that our work to evaluate the federal government's response to the COVID-19 pandemic can be responsible and objective. And I am pleased to be leading this Select Subcommittee alongside my friend and colleague from Ohio, Dr. and Chairman Wenstrup. Chairman Wenstrup and I, as I mentioned, have partnered on several shared priorities, and it is my hope that we can work constructively to advance the critical purpose of preventing and preparing for future pandemics. Because above all else, I'm confident that no one in the United States, regardless of political party, wants us to relive the experience of another deadly pandemic. Today's roundtable offers a meaningful opportunity for us to begin the work of objectively evaluating our nation's response to the COVID-19 pandemic, and I am pleased to have invited Dr. George Benjamin, fellow emergency physician and executive director of the American Public Health Association, to participate. However, I am troubled that other participants on today's panel have a well-documented history of downplaying the gravity of the COVID-19 pandemic and defying the overwhelming consensus of America's scientific research and public health communities, including by advocating for a reckless herd immunity strategy for a deadly novel virus we knew little about, and drawing into question vaccine policies that contributed to the prevention of more than 3 million fatalities. To successfully carry out the charge of this select subcommittee, our work must lead with facts and follow the science. Anything less would be a misguided use of our time and taxpayer dollars and a betrayal of the interests of the American people. I yield back.